Hi, we're here today to do some saddle fitting with Rhonda Martin. Rhonda's become a very dear friend of mine, and she is the most expert individual I have ever visited with or had the opportunity to learn from what we can do for the entire horse, from the foot to the back. So it's my privilege to introduce to you Rhonda Martin, and I'm glad you're here.
Oh, thank you, Donna. I got to know Donna about 9 years ago after I moved to Missouri, and I was at a reining in St. Louis and had the opportunity to try one of their very first saddle pads many generations ago compared to the pad we're going to talk about today. So through my friendship with Donna and our mutual experience working with horses and trying to learn from horses, she has developed a phenomenal product that I consider a solution for the equine industry. So today we're going to work with a number of horses, and what we would like to present to you is our combined knowledge of how we've utilized the pads, different horses, different equipment, to try and come up with a series of solutions that help you see your horse in a more complete light. What is the horse you are working with? We're going to show you horses that have positive conformation in postures, horses that have negative conformations in postures, and the solutions we've come up with so that we can help you to have a healthier, happier horse and a safer, better riding experience.
Rhonda, this is my mare. This is Fancy. She's a 16-year-old quarter horse. And I have actually, she started on the trail when she was about 2 years old. So she's had a lot of hard miles, even before the CSI pad came along, that we have worked with. And thanks to the education you've given me, I've become more aware that we have a few postural problems with her. So I know you've been in the equine industry for about 22 years now, and you bring a lot of expertise to me. And I am so honored that you're here to help me with my horses. So please, tell me what I can do to make my horse happier.
All right, well, that's what we're going to do. I'm so glad that Donna invited me here today, and what we want to discuss with you is something I do every day with all my customers. I've been working on horses as an equine massage therapist, doing body work of various types for the last 22 years. I have an extensive background riding and training my own show horses. I've got a lot of titles in endurance, reining, now dressage and western dressage, and I'm always looking for answers. And they come from the horses. It's been the horses over the years that have taught me what I needed to see, if I can just slow down and take a good look.
Okay.
If something is bothering you about your horse, you've got this hunch, you need to stop and reevaluate before things go so far that a horse has actual behavioral and training problems. So what I'd like to discuss with you is the history of Fancy. You said she's been a trail horse since she was 2. She's 16. That is 14 years of riding. What we want to have happen for horses is a pain-free riding experience, not one where they're compensating with their body because of pressure and friction. So has Fancy ever given you any indicators that she had hurt?
Absolutely. She was a lot of the reason that we created a Saddlepad, because the third day of anything I would do with her, whether it was on the trail out west or whether it was just keeping her conditioned at home, and even when I put her in cattle, the third day of anything, she would get really sassy. She was extremely cinchy, and if you didn't pay attention to her, she was going to let you come off, because she just had all that body language. And unfortunately at that time I wasn't smart enough to be aware. You know, I just kind of thought, come on, you know better than this. Don't act
right,
like this.
You're tired,
Yes.
you're a little sore, come on, you kick them and get going.
Yes.
That's been a mentality that most of us have grown up with, and horses are no different than people. 65% of their body is soft tissue, meaning muscle, connective tissue. The rest is their organs, bone, tendon, and ligament. So when you've got 65% of the body that can be affected muscularly, if that isn't ever addressed, we start to put negative memories into the muscle. So you will see horses change over time, and in the past we just assumed that, oh, the horse is aged, so they're dropping in the back right here. Or if you were just lucky to genetically have a horse that just maintained a good top line. There's so many factors. We've got dentistry, we've got the foot balance and how that affects the way the horse carries themselves up above. I see a lot of issues with foot balance, that the horse is uncomfortable, so it causes them to drop a shoulder and change the way their back looks. And then we have the rider impact on a static saddle, which is generally a solid saddle, pad, and then the soft tissue of the horse. So how do you make those things balance out? The first thing I tell people is have your horse standing on a flat surface, and we've got fancy on some concrete, and I look at, does the horse naturally want to stand square? Can they, in a general way, stand as a table with 4 even legs? You'll see a lot of horses who are uncomfortable shift over to one leg, then the other. I don't mind if a horse wants to rest a hip. It's when it becomes a constant change of posture where it starts to feel like it might be a relief from some pain or stiffness. My goal with everybody that I work with is to sort through where these performance changes are happening. Do I have a dentistry issue? Do I have a foot that's slightly off balance? That might be 3% of the total horse. Do I have a muscular problem in the shoulder that's come from a foot or just general performance? That might be 2%. Do I have a saddle fit issue? That could be 5, 10, 15, 20% of performance. Do I have any limb issues? So many performance horses have stifle and hock issues. It's very common for them to have arthritis in the hock, just like it would be for you or I as we age. And then nutritional issues. Where is that horse at nutritionally? You start adding up all those percentages, and you might be at 20% of the performance of that horse, and say you're a competitor. You walk through that show pen gate, you can expect to lose 20 to 30% of performance. So if we just say take 20% of performance because of show ring issues with horses, and 20% of all these little things that add up, you're looking at missing maybe up to 40% of the total performance of your horse. Wow. So it does not matter to me if you are a trail rider, because trail riders take their enjoyment of the amount of miles that they travel just as seriously as somebody who is jumping, showing a Western pleasure horse, reining, or cutting. Fancy agrees. So my number one goal is to get that horse and analyze the conformation, all those things, look at the posture. Does that horse carry itself as well as it could for its conformation? And then fit the equipment to that horse. And where I have loved your Saddlepad is that it is a dynamic solution. A horse is a dynamic moving structure. We have a hard saddle in between, and we have a dynamic moving rider. So we take movement, stiff and solid, and movement, and sometimes they don't work so well together. Right. So the CSI Saddlepad, and we're going to demonstrate how that works in a few minutes, creates a dynamic, moving, fluid structure that supports the dynamic movement of the rider to the horse and enhances the process and hopefully keeps that horse much more comfortable. But before we get into that, I would like to demonstrate to people a couple of basic techniques to see if your horse has existing pain prior to trying a new saddle pad or new equipment. You should evaluate what you have and look at that before you introduce any new variables. So when I think about Fancy, she looks fantastic for a 16-year-old mare. She's fairly straight through the top line. She really wants to stand very square and pretty even on all four legs. Many times I'll see a horse that in the front end will look at the breast of the horse. You'll see them shift like this and bear much more weight on one foreleg than the other. That definitely is a problem that we want to have addressed through a veterinarian and shoeing, and then look at the total effect that that has up here in the shoulders. Because if a horse is to carry itself with uneven shoulders, that is going to have a huge effect in their comfort in the shoulder up here. So number one, pain. Have you ever gotten the feeling, well, you said after 3 days of riding, she wouldn't be herself. Were you able to check her to see?
Oh, yes. And when you would do any kind of testing on her top line, she would just literally hollow out and almost drop to the ground.
Yeah.
And we've been blessed because since the pad, we've been able to keep her sound and pretty supple. But as you've shown me, there's a lot to learn, things that are hidden.
The number one thing I have people check for as I'm going through the whole process is I want to make sure that this horse has good dentistry. Because if the horse has any problems with their occlusion, hooks from a lack of dentistry, as the horse moves, their tongue moves back and forth inside their head. And if there are sharp edges, they can be getting ulcerations on the tongue and on the cheeks. So a very, very simple check is to gently take one hand over the bridge of your horse's nose and one hand under the chin and see, can I comfortably move that horse's jaw back and forth? And Fancy is a yes. If that's uncomfortable, they'll pick up their head, they'll move their head away, or you will feel that the jaw is locked. The next thing I like to show people is the very top occlusion, the top of the horse's jaw overlaps the bottom jaw. And right here, this groove is the place where the top teeth overhang the bottom teeth. And you can take your thumb on the bottom of that groove and push up the cheek onto the teeth. And she's moving her head a little, but I can feel through the cheek that her teeth are smooth. Horses get wavy points, and that is what dentists, veterinarians file off. And when those points stick out, you can feel it directly through the skin here. They'll feel sharp, and when you push the tissue against the jaw, the horse will react by picking up its head and being very uncomfortable. So I always do it 2, 3, 4 times to get a true reaction and see what we've got going. Many of you are educated. The internet's phenomenal. Digital media's phenomenal. There's so much information for people just to research online. We see lots of examples of horses' backs being palpated for soreness. The number one thing I like people to look for is, what does your total top line look like? And then we're going to palpate for stiffness and soreness. This mare is fairly even. She may be just slightly rump high. And when we visualize this total space, I'm looking for the space in here. How hollow is she, or how straight and full is she?